Hey, if you're new or just joining us at Mums at the Table, please like, share and subscribe and keep it locked right here. We're talking about tongue-tied. It's an issue that some of our mums in our closed Facebook group have talked about and raised questions about should they have the surgery or not.
It's an interesting question to ask, and this is where it's really important that we utilise the whole team that comes around having a new baby on board, because tongue tie is something that can be identified really early in a bub's life, sometimes in the first day or two, sometimes in the first week or two.
Can I just go back and say, what is tongue tie?
So tongue tie is when there's a little bit of skin underneath the tongue that's a bit thicker or doesn't allow the tongue to move properly. And that can have really big implications in terms of the ease that a baby can breastfeed, the ease that a baby can latch onto the breast and then feed effectively. So this can be a really massive deal, because feeding your baby feels like it ought to be one of the most natural things in the world. And the experience of a lot of women is that it's the hardest thing that they've ever had to do.
And then they find out later on that their baby was tongue-tied, and so they're dealing not only with hormones, but the fact that their baby might need surgery. What happens if they don't have the surgery? Or what happens if the mum decides that...
So you can manage tongue-tie without surgery. It's really important that we enlist the help of a good lactation consultant, and places like the Australian Breastfeeding Association can be really helpful in terms of pointing you in the right direction. The problem with tongue tie is that babies can't latch properly, and so, but then babies aren't born knowing how to breastfeed. Mums don't deliver a baby and instantly know how to breastfeed. So this is something that babies can learn and mums can learn in terms of different positions and those sorts of things for breastfeeding.
Right, so get some help and get some support.
Utilise
and don't give up. Don't give up trying to breastfeed.
Absolutely.
So with the surgery, what are the long-term impacts of having a child undergo this surgery for tongue tie?
So it's a really simple procedure. It's not a massive deal, but it's also, by the same token, you don't want to do anything to your child that they don't really need. And so the key things that I would be looking for is if your baby wasn't drinking appropriately, not getting decent wet, not getting the usual number of wet nappies that they have, not soaking them through, and in the early days we keep a really close eye on bub's weight to make sure that they're gaining weight appropriately.
Because obviously it affects their intake. So you want to make sure that your baby's able to eat. Does it affect their speech later on in life, or
generally Generally it doesn't affect their speech later in life, but in a few cases it can. But those are the exception rather than the rule.
So the thing I get here is to make sure baby's healthy. If they're losing weight,
then go and see your doctor and look into getting an experienced person to fix your tongue tie.
Great advice. So important that you get the professional help that you need.